Today is World Voice Day. It's a day designated to get us thinking about something that so many take for granted, the ability to speak. Local 10's medical specialist Christy Kruger is here now with the details.
Something we don't take for granted in our business for sure, but there are some key do's and don'ts when it comes to protecting that voice of yours. Drinking lots of water can help protect your voice, while drinking too much coffee, too much tea, too much soda, I'm guilty of that one, can have some damaging effects. Experts say the key is paying attention to your voice and recognizing when you're starting to have a problem.
A voice problem that's come on kind of gradually and gradually gotten worse, and no precipitating episode. You didn't have a cold or flu or virus or something like that.
So also in today's HealthCast, a look at the very latest research regarding key medications for heart disease and stroke. Our cardiologist, Dr. Soffer, has more in his Second Opinion report.
An aspirin a day keeps the cardiologist at bay. For years, that mantra has been considered a key factor in reducing the risk of heart attack and stroke. While it appears to hold true for people who've already experienced either condition, Dr. Gervasio Lamas says that's where aspirin benefits stops.
It really shows that science evolves.
The Food and Drug Administration says people should not be taking aspirin to prevent a first heart attack because the risks are greater than the benefits.
What's a side effect of aspirin? Gastrointestinal bleeding and hemorrhage in your head.
There's also confusion about who should be taking statins. More than cholesterol numbers, Dr. Lamas says the key is a calcium score, which better shows the health of your heart.
What happens is that when fat gets into the arteries, the way the body responds to it, sort of as a healing process, is it lays down these little flecks of calcium.
When her cholesterol levels came back high, Jackie Mastrangelo followed doctor's orders to take a statin. But when her calcium score came back low, she welcomed the recommendation to stop the medication.
And the funny thing is, my cholesterol's lower now off of it than it was before.
If you've already had a heart attack, you're at much higher risk of a second episode, and you should be taking low-dose aspirin daily. Likewise, if your calcium score is high, statins can be most certainly beneficial in lowering your risk of a heart attack. With your Second Opinion, I'm Dr. Soffer.
And another note on all of this, once your calcium score is high, there's really no way to lower it, but you can help your heart stay healthy by managing things like stress, losing some weight, eating a healthy diet, and of course, not smoking at all. With your HealthCast, I'm Christy Kruger, Local 10 News.